Thank you, everyone, for being here today. I want to introduce Sarah Darcy Myers, and she is going to be speaking to us about the effect of the pandemic on kids and mental health. Sarah, can you tell us a little about yourself?
Hi, thank you, Gretchen. First, I just want to thank Long COVID Families for including this important topic. I think mental health is something that is not always talked about openly and freely. And I think the pandemic, one of the good things for me in the mental health field that's come out about it is more awareness and talking about mental health and disorders. But how this pandemic is affecting our children and our adult society in general is definitely a global phenomena that I'm not sure any generations currently living have ever experienced. So there's still so much more to know, but I'm excited to talk to you guys today about what I'm observing. Should I tell you a little about myself, who I am and what I'm doing?
Yes, I'd love to hear like a little bit about your background and how you got to be in the space to be passionate about this kind of cause.
Yeah, perfect. So, well, I'm from a very small town in Southeast Georgia, and my dad's a psychologist. My mom is a nurse. My dad was literally the only mental health provider in multiple counties around us. So growing up, I've always had an interest in being nurse or psychologist, therapist, and so that manifested into going to college and figuring some things out for myself and landing in social work because I was really drawn to working with marginalized communities and really understanding people and humans are more than just our thoughts and behaviors, but understanding how we interact with all of the systems around us. And so, yeah, started out in medical world doing nursing home, hospital work, and within the hospital medical field was really allowed to work with populations that I would have never imagined working with as a social worker. And like clients that have cancer or chronic illness, like chronic kidney disease, heart disease, women's health issues that, we sometimes in the medical world see things that are societal based issues like domestic violence or poverty and how that plays into access to care. So that medical experience really kind of propelled me into more specialized practice into private practice and working with individuals who were we're dealing with general things like depression, anxiety, attention deficit hyperactivity disorder, parents adjusting to parenting, women postpartum. But the crux of all of that is people living with chronic medical conditions has been a population specifically that I've been very drawn to working with and very interested. And I think it's like the outpatient version of the hospital work, if that makes sense. I get to work with people ongoing. And so, yeah, so that's what I'm doing in private practice and seeing some of the things from COVID and people coming in who have never had medical complications or chronic illness now experiencing new mental health disorders, but a common thread is they may have had COVID or they've had COVID multiple times, and just changes in behaviors and disruptions in their normalcy causing them just a decline in their own overall happiness in life. So yeah, I'm really excited to talk to you guys more about that. And yeah, just I love the work I do and love really advocating for these pockets of our communities and within our society that oftentimes really aren't discussed or kind of, yeah, are forgotten, are marginalized peoples. And I think it's really important to bring them to the table in a
And I think
conversation.
sometimes when we think about chronic illness and especially children with chronic illness, we don't really always factor in the mental health effects of it. And that's something that I think as a parent who's been, a caregiver,
Mhm.
um, it's one of those things that kind of hits you sideways. You're like, okay, I knew we were going to be dealing with some health stuff, but there's this whole other thing over here that's really, really important in impacting my kid.
Yes.
So grateful there's people like you that are passionate about this cause.
Okay.
So how would you, from your work and your experience, like how would you say, what kind of effect do you think the pandemic has had on kids generally?
Yeah, it's really been this kind of a global phenomenon, right? Like the pandemic is happening. The entire world is experiencing this pandemic in ways that I think shocked so many of our systems of society. You know, and because of that abrupt disruption in our normalcy, and not really knowing what's coming next has really had a profound effect on people who have never experienced mental health disturbances, and then people who are already living with mental health disorders. And the pandemic has definitely layered an extra level of difficulty to those people who, specifically those marginalized communities, communities of color, you know, pockets of poverty, people who are already dealing with chronic illness, those kinds of things, or dealing with mental health disorders. And then we have multi-systemic failure within, you know, our society, and the impact has been huge. So some of that, though, of working specifically with kids, you know, this is a back to school conference, so I want to make sure to give you parents like information on what this looks like in our kids, right?
Yeah,
So a lot of that pandemic piece has been, you feel it, increase in stress, you know, isolation, changes in our routine and our schedules, and this constant adjustment to temporary new normals. And I think that, you know, one of the old adages of parenting that we hear all the time is kids thrive on consistency. We know that, you know, we know that kids that have consistent access to food, consistent access to shelter, consistent access to education, consistent parenting, that those kids usually thrive as adults. That consistency is something that is also crucial to that social emotional development and cognitive development, as we age from birth until, you know, 100, however age we get to.
right. Yeah.
So those, some of those things that come up though for me are like the virtual learning, going from a school experience that societally has been in place for decades upon decades at this point, right? Then transitioning into hybrid learning, changing access to how we have extracurriculars, changing access to after school care or what that looks like. And even, again, that isolation piece of lack of social engagement. And we know that kids need social engagement. This is how children learn, is being around peers. And it's also a crucial part of their ongoing development, social emotional development, psychosocial development, and their identity. Yeah, so that's definitely, those pieces, I think, and those changes have really been the driver for all of the new mental health diagnoses that we're seeing. You know, we know there's about a 60% higher risk of mental illness or, you know, a mental health diagnosis after COVID. We're seeing numbers like 55% increased use of SSRIs or antidepressants in people post-COVID. And, you know, those are, that speaks to the psychosocial effect that COVID is having on us as people.
It's like, what, when you see younger people, kids and teens that have, you know, some anxiety or depression, or what kind of, how does it present in kids as far as what you're seeing?
Yeah, for sure. So again, these systems that we have in place in society, like school, those built-in extracurriculars, that dance class, karate class, just access to going to the doctor whenever we call, without having all these changes, or going to school not having to worry about, do you have your hand sanitizer and mask? Do you have replacement masks in case they get wet today? All these changes affect that social emotional development, and those stages for each age is specific to the age of what we're kind of expect, so really that formation of identity and how we think of ourselves and how we think of ourselves as it relates to interacting with the world around us is really starting to happen like in early elementary. And so whenever that gets disrupted, we end up seeing what I would call behavioral disturbances, like just suddenly hate going to school, or even sensory issues. I've had kids come in that never really complained about the tag in the back of their shirt. Now all of a sudden it's the tag, it's the toe line on the socks. And those of us that have kids that, are autistic or even ADHD, these might be some familiar things to us. And it's interesting when you see kids who are neurotypical coming in with some of the same issues, but we see defiance, temper tantrums, some tearfulness. And those are really warning signs that there's probably some adjustment and some issues going on emotionally that maybe should be checked out. And that conversation should really look like maybe contacting your child's doctor and saying, hey, I'm noticing some changes. They're concerning. My kid doesn't seem happy anymore. They're not like themselves. Like, you as a parent, like, your kid. And if they're not acting like themselves and it's a consistent issue, it's definitely time. And when I say consistent, I mean like even just 2 weeks in a row, like that may be worth going ahead and making that call and touching base. And I would hope that the pediatrician would then refer you to a mental health professional, a licensed person such as myself, like licensed clinical social worker, a psychologist or counselor. Those are going to be people who use evidence-based practice and have the ability to diagnose what's going on with your kid and give you support and resources, but also then apply the treatment that's needed to help address some of those behaviors.
So when, as a parent who has a child with a chronic illness, and knowing that there are the mood, there's the mood part of it, and then there is the physical part. How do we know, like, what are things parents can look for, or to try to, the information they can try to gather to get to their doctor or their psychiatrist or their social worker that kind of helps you figure out, is this a mood related thing, or is there something else going on with my child? Is there, a physical cause? Because, we know that some chronic illnesses can have effects on mood. Can you speak to that?
Absolutely. Yeah. So clinical depression, we call it the Mental Health Bible, the DSM-5. That is our diagnostic and statistic manual for us clinicians, providers, to help us really identify symptoms and then apply a diagnosis, right? So one of the key pieces with depression and a diagnosis of clinical depression, major depressive disorder is what it's called, is that there is not an underlying medical cause. So that's the key piece when it comes to, is this post-COVID, post-infection, neuroinflammation, the brain fog, headache, fatigue, all of those kinds of things, which can be chronic and ongoing for many long COVID people, or are we looking at a mental health disorder? And I feel very strongly about proper assessment and diagnosis. Diagnosis drives treatment. So if we don't have the proper professional or licensed professional evaluating and assessing as part of the team of our providers that are treating us, right, we end up missing pieces. And unfortunately, mental health tends to be the one that gets missed a lot. And so I think we get told a lot, sorry you feel that way, or like, oh, I hate that for you, and it's like, well, wait a minute, it's something a little bit bigger than just I'm having a bad day.
Right.
So depression is definitely going to be something more where, well, there's specific criteria. I can pull up a PDF here in a moment, but there's specific criteria that have to be met to be diagnosed with depression. And people really, that's the other piece of proper assessment and diagnosis. Again, diagnosis driving treatment. If you don't have a diagnosis of depression, I would be weary with starting medications or other things before I've been properly evaluated. I think that's just,
Mhm.
I think that's probably normal for all of us, right? Like, before
Right.
I start anything, tell me why I need it.
Right.
What is this? What is it for? What's it going to do? How is it going to help me? Being your own self advocate. So playing back into that piece of knowing this is different from my normal. Take notes, uh, write down what you're experiencing. You can write it in a note on your phone. We are all like tech attached, right, at this
Mhm.
point. So put it in your calendar of the symptoms you're experiencing. Is it brain fog today? Is it, lethargy? Is it, I got another headache going on? Or is it, I really have zero joy? Like, things that used to bring me so much pleasure and joy no longer are, they're not bright and shiny anymore for me. Or, my friend that I would normally talk to every few days has reached out to me multiple times wondering if I'm still alive because I haven't responded. That's a good sign that there's probably something more going on than just, post COVID or post infection neuroinflammation that should be addressed. And how you address that really needs to be with trusted providers, your primary care doctor, asking for a referral again to that licensed clinical social worker down the road to get that proper evaluation and ongoing treatment.
Okay. Um, so when you have a parent that comes to you whose child maybe recently got diagnosed with long COVID or any other chronic illness, what kind of stuff do you try to educate them about, or like what kind of advice are you giving them, guidance are you giving them?
Yeah. So the chronic medical conditions and people, those of us that live with them, um, it can be a tough spot to be because our society is kind of in this recovery model space of let's fix it, let's get you back to normal, and so it really kind of unfortunately overlooks that sometimes even grief that we may experience when we end up with this chronic medical condition, and the stages of grief get pushed aside,
Yeah.
and then we're struggling. It's hard to find joy and happiness, and those medical conditions, those people, they end up becoming part of a marginalized community,
Right.
and those chronic medical conditions just really leave people um, at risk for mental health related issues. Just like folks with mental health disorders previously have a very high comorbidity of chronic medical conditions, which genuinely opens the door for COVID, for example, to come in and wreak havoc because these people have been dealing with medical conditions and chronic aspects of medical care in addition to ongoing mental health treatment. So newly diagnosed people, in a weird way, it's like, welcome, you're safe here, because there's a lot of us who've been dealing with this for a long time. I think of cancer patients that I've worked with in the past that are going through chemo and have brain fog and feel like I feel depressed, and there's pieces, elements of ongoing treatment that genuinely cause disruptions. Remember that consistency piece I was saying earlier, how consistency helps us all feel safe and comfortable, while chronic medical conditions, we may have a flare one day, or, and I'm no longer able to go to that party I had planned this afternoon because I'm so fatigued. Or I have to go get lab work drawn because, I had a cold and stuff just seems to be, out of whack again. Just when I just accepted this new job and was super excited about starting it, now I'm dealing with this. Or
Inconsistency seems to be like the most consistent part
yes,
about having a chronic illness. It's
yes,
the unpredictability.
yes,
So that stability piece is out the window a lot of times until for eventually a lot of times people can get to a place where they understand there, but there's a long period usually for most people when they're still just trying to figure out, why is my body
what is
doing
this?
this? Why am I going through this? What's going to happen tomorrow? Am I going to wake up feeling good, or am I going to wake up feeling like I can't get out of bed? Or so that's, and we often talk about how disability is an identity disruptor, which that can really shake you as a parent when you see your child who maybe was the star basketball player and now they can't even make it to practice. It's for the kid that can be pretty earth shattering because that's, that's their outlet, that's their friends, that's their, a lot of kids have their identity. I'm an athlete.
So those pieces of the newly diagnosed chronic illness are going on, we're dealing with chronic medical conditions post-COVID, or we see this even with other post-infections. We have seen the phenomenon of the development of autoimmune neuropsychiatric disorders such as PANS and PANDAS that, primarily is due to the introduction of strep into the system. So we know that there is some precedent for seeing post-infection neuroinflammation and then ongoing neuropsychiatric impacts. And those pieces of the grief, like establishing that new normal and what that looks like. And when you're talking about children who are in the middle of establishing who they are, how they interact with the world around them, and then they get hit with this, chronic illness diagnosis or condition, really, because right now, do they even consider post-COVID a diagnosis? We're still like so new in, ongoing understanding of what we're dealing with after this pandemic. So that identity and just really, how do I participate in everyday life now? Because before, this is what life looked like, and now it looks very different. And that makes me sad, or it makes me feel anxious because I know I have to do this because it's my role, or, and a lot of that's from the adult perspective, but from the kid perspective, it's something like, I went back to school and I wasn't with my same reading partner because my reading level dropped. And so then it's this, what am I to expect? Like the ball was rolling in a certain direction, and then it's like, am I rolling in a whole different direction? Has it stopped rolling? What's going on? So kids, again, they're going to show probably that in behaviors. And so as a parent, the piece that you can really impact that is in how well they adjust to this new normal. Embrace all of that as part of the new normal. I sometimes, I wake up with it, I think of it kind of like a checking account. There's only so much money to spend. And sometimes whenever we think of chronic illness, that's the best way you can think of it. Like, I only have so many little energy deposits today. And, going to my friend's wedding on Saturday is really important to me. So I'm going to conserve my energy to get there. Like that day, I'm probably not going to go do my mile-long run, knowing that when I do my mile-long run, I feel great, but I'm usually spent by 2 p.m. You'll start noticing those pieces of, days that start off kind of rough, days that start off really good, what the implications of that is just for participation and normal routines and activities. But as a parent, it's really keep promoting engagement in those activities. You may have to find new ways and new strategies for engagement. Like Maybe spending the night at a slumber party is no longer an option because, we really can't risk getting a cold or anything right now. And so does that mean that they can't go? Like, why can't they Zoom in and do like an activity together? Maybe I could think of things during the pandemic. That was the other part with the pandemic is, we started doing art class online. We started doing karate and dance online. Like, is that the most favorable way? Maybe not, but it's still a way for our kids to still be involved and with their friend groups. So maybe an activity, where you have a set of painting or something and the other kid on the other end has it and your kid has it on your end, and they can still spend some time together doing something that way. The other piece is that, exercise and nutrition. Like, as much as I hate to say that, let me be a real human for a moment here. Like, isn't that usually the worst answer when you go to the doctor and they're like, you just need to exercise more and eat better? And you're like, whatever, I'm tired of hearing that. That's so important, though, to your overall system of functioning. So if we're not feeding our body well, if we're not treating our body well, but we're asking it to handle this chronic medical condition, are we really setting our body up for success there?
Mm-hmm.
Maybe not. So I think it's not an area to shame yourself, though. It's an area to, like, this, it helps us engage in activities of our daily life.
And
Meal
to find
planning.
ways that it will work for your child. So,
Yes.
if exercise used to look a certain way, it's going to look different now. And it
Yes.
should, because doing it the old way can actually harm your child and make them sicker. But, there's different ways. There's different
Yes.
online
There's
yoga.
There's
And
YouTube yoga. Oh my
yeah,
gosh. Cosmic Kids. How much do we
yes.
have your kids grown up with that? Mine have. Cosmic Yoga has been one of the best things that they ever found.
Yeah. To be like
yes,
open-minded to when you think of exercise, it's going to probably look different if your child's chronically ill.
Yes.
And to be willing to adapt and
yes.
that.
Movement is movement.
Mm-hmm.
And movement, we know, like with mental health, movement makes our happy juices happy.
Mm-hmm.
So it makes them start cranking out for us. So sometimes that's a dance party, put on our favorite song, the Cosmic Kids yoga on YouTube. Sometimes that's something as easy as genuinely standing outside with the dog and throwing the ball. Like,
yes.
just walking out of the house,
yes.
Changing our four walls, that's movement. That's important. And, that other piece of socializing, finding time to, again, adjust to, if it has to be virtual, to make it be virtual. But don't be afraid as a parent to ask questions of other parents to ensure that your child is safe while engaging socially in person. So if that looks something like, do you guys mask while you go out? Are you doing crowded things? Have you been anywhere in public, traveled in the past, week or so? Because some of those things, it's not personal at all. It's genuinely, I want my child to be able to engage with your child. In order to do so, I need to ask a couple of questions. I feel like it's no different than, knowing the parent before you have a slumber party, right? Like,
yeah,
kind of the role. So I think being assertive and brave is sometimes a challenge for us. And I know COVID can be a hot topic for many people with the politicalization of the illness, of the virus. But let all that go and just focus on, my kid needs to socialize and who are safe people. Find your supports, find the people you're comfortable talking with, like real talk with, and, engage them as much as you can.
And like, people are they're human. And so when you say, like, if your child physically isn't up to like playing hide and seek, but you say, listen, like, my kid really misses playing with your kid. Do you think your kid could come over and we could do like sidewalk chalk, or just do a little low key activity where they can hang out?
Board game.
And when you tell the parent, why, a lot of times, like, you'd be surprised how many of them are like, absolutely, and we can do this and we can do that. And it takes kind of the whole, like, that big elephant of the political part of it. Then it's just about two kids who want to play together.
Yes. Yes, exactly.
Yeah.
And I think of like arts and crafts or like board games,
Mhm.
I mean, I love a mean game of Uno. So like these are fun things that even as families that if right now interacting with other people outside of your home, that you can still engage with your kid in a way that is still some socialization. My hope is though to increase that peer-to-peer, that
Yeah.
age-related relationship, to engage them in that as much as possible in whatever way feels safe to you and your
Yeah.
family. And that self-advocacy piece. So that's really huge for kids when they get back to school, and that's going to be a part of ongoing chronic medical conditions. I mean, people who, again, have been living with these chronic medical conditions, we are our own best advocates, right?
Yep.
And so teaching your kids, I know as a mom myself, uh, I have no problem speaking up for my kid and what I need my kid to have access to. And I don't like that treatment, or I have questions about this, please explain it to me. Um, by role modeling that kind of advocacy, we help teach our children self-advocacy, because we aren't, I mean, they're not going to be under our wing forever and ever, amen. So teaching that self-advocacy is going to be huge. And also being able to find the positives in life and the joy and enjoying the little things. Chronic illness is not a death sentence of joy and happiness. Like,
Exactly.
it's
Yeah.
something, we're still living. We may have to have adaptive equipment. I think of kids, that I've worked with cancer, that have to use wheelchairs for a short period of time. The wheelchair allows them to participate in activities that otherwise they wouldn't be able to participate in. So having some of these adaptations really give opportunities for engagement. And that's when I say establish that new normal. Open your mind outside of our normal expectation of how we interact with society, and be creative in finding ways with the goal of maintaining engagement, socialization, relationships.
Acknowledging how important it is for our kids to learn to self-advocate, and especially if they have a chronic illness, what are some specific ways we can help teach them to do that?
Yes. So we know that kids learn from modeling, right? So you demonstrating, like, don't be afraid to, in front of the children with the doctor, say, well, help me understand that treatment better, or help me understand options here, and
Mhm.
engage them with your child. So the other pieces that are going to be the huge, like the cornerstones of self-advocacy, are assertive communication skills and knowing how to set some boundaries. Boundary setting piece is going to be big, where we think of boundaries sometimes as a little scary or something. We don't want to hurt somebody else's feelings, but kind of like you were saying earlier, like our new having a friend over, and we're dealing with some fatigue today, but it's important for, my child's really been looking forward to engaging with their friend.
Mhm.
Um, Going ahead and saying, hey, like, we're a little low energy today. Are you good with things like the board games, crafts?
Mhm.
I have some things really exciting like planned out for y'all to do. Does that sound good? I think,
Mhm.
as a parent, we can sometimes do a little behavior prescribing of, that's going to be a lot of fun to paint this craft we just picked out. You're going to love it. So I
Mhm.
think, team some of that up. But the self-advocacy aspect with communication, assertive communication skills, saying what you mean, meaning what you say, and setting those boundaries of, what, I can't do that today. Thank you for thinking of me and inviting me. Is there another day that we can do that? Would it be okay if I reached out to you after checking my calendar? Just as a parent, doing that for your child teaches them that they can do that too as they get older. I think that's one of the biggest things I know as an adult that we often have trouble with, right? Setting limits and
Yeah.
saying no.
And it's
You
something
know,
you learn when you become a part of the disabled community. You start
yes,
to learn that our notions of how things should be aren't always healthy.
yes,
So being flexible with
hmm,
plans and with things you do is like so crucial. And the
yes,
people that are going to be involved in your life have to have some kind of understanding of the need for that flexibility. And it's just like when we
Absolutely.
ask the schools and the workplaces for accommodations, we kind of need to educate sometimes our friends or our kids' parents even,
That's
like
right.
ahead of time, like just so you know, like we would love to have, Sally over to, do have some painting time and play, hang out and do some artwork. But sometimes my child like has a bad day, it's unpredictable. So I just want to let you know ahead of time. And that way you kind of are setting it up. So, and also modeling it for your kids that like it is
Or even
okay. You
having
don't
a
feel left
time
out.
limit.
That's okay.
Yes,
That's not a reflection on you. That's just
yes,
the way this goes. And the
yes.
sooner people can kind of like wrap their head around
Mhm.
this is the new part of the new normal, it's
Mhm.
gonna make because we as parents we kind of resist it. It's like these are the rules of polite society,
Yes, yes.
So it's kind of good to wrap your head around
Mhm.
being flexible with all of that and modeling it.
Yeah. Or, and even some of those boundaries can be as simple as like setting a time limit. Like, I would love to have Sally over from 1 o'clock to 2 o'clock. Does that work for y'all? I mean, and those are the kind of things, if we know that there's bursts of energy and those bursts of energy last sometimes 2 hours, well, maybe we go ahead and have an exit before we bottom out,
Yeah.
so that way, you're just preserving some self dignity that way too, because I know whenever I'm not feeling well, or I'm at the end of, I've used all of my spending today,
Mhm.
that in amount of money, that it's like, I really don't, it's too hard to even think about how to get you out of my house. So
Yes.
let's just do like a set this time, or like you were saying, like definitely want you over, let's do this craft,
Yeah.
so all those boundaries are definitely important. And again, those are pieces of that social emotional development, the psychosocial learning that are really crucial. And these kids are at crucial ages to learn those and be able to practice those skills, because once they get to adulthood, if they haven't had opportunities to practice those things, what does that look like? It looks like anxiety. It looks like depression. And it actually may be those things. Absolutely. And from a therapist standpoint, with the kids that I work with, touching on some of the things you just mentioned, those are skills like teaching some radical acceptance. Like, I hate to say it is what it is, but accepting that this is something that I may be living with. If
Yeah.
it goes away, great.
Yeah.
Love that for me. But if it doesn't, does that mean I'm living a life of doom and despair? Like, no. So I think being able to just, kind of teach some mindfulness based thinking as well around that.
Mhm.
That, again, I know that I only have so many pennies to spend this morning and throughout the day. And I want to be wise how I use that, and how I expend my energy. Or, being able to find the positives still with all of those changes, is just going to be, that's going to be the part that I feel like is really important with that new normal and establishing it. This new normal isn't bad, worse, otherwise. It's different, but different sometimes is amazing and even better than what was before.
Yeah.
So, and I agree, like, the toxic positivity of everything's okay and just, mustering through it doesn't help anyone.
Right.
And so I think actually recognizing I'm tired, and when I'm tired, I feel better when I rest.
Yeah.
Or, I'm feeling a little brain foggy today, so playing this board game is kind of difficult for me, but painting would be easy. I know I keep going back to that one because I feel like it's something really nice to engage in. I love to paint.
Mhm.
But so, little bias there, but I definitely feel hopeful for people to learn more about maybe some of the community that they're already joining.
Mhm.
There's so many people who've already been living with chronic medical conditions that you can find access to these supports on Facebook, social media. I know gets a lot of bad rep, but within social media, there are pockets of good community and connectedness that otherwise we may not have access to. So using the technology and modern world things that we have available to us to help us find that joy and quality in life, go for it. Looking at acceptance and reframing it to embracing what you're living with and how life feels and looks for you, and especially in a child who might be dealing with long COVID, or chronic, medical pieces, post-infection, that embracing as, when we react to the symptoms we're experiencing as like abnormal or this is horrific, fix it now, as a parent, we're kind of modeling that same behavior for our kids.
Mhm.
Listen, being terrified and scared and not knowing what's coming next and what is this going to look like, those are all absolutely normal parts of, early diagnosis stages, right, of chronic medical conditions. And so those are all very normal things to experience. And I'm not saying shape it for your kid that this is going to be great that you're tired by 2 p.m. every day. That's not at all
Right.
I'm saying. I'm saying that the acceptance piece, if you embrace the challenges that are coming as, this is part of what I'm dealing with medically. And I know I have supports in place. I know what to do when. Having those little kind of plans, I think, allows us to like actually deal with what comes up when it comes up,
Yeah.
and kind of maneuver. And some days are just hard, and it's okay to really just accept that today is just really hard, and I need a minute. And what does that minute look like? How are you going to spend that minute? Being intentional about how you spend that time. Is it taking, like I can think of some of the kids I've worked with, like talking to their parents about making a fun bubble bath, or, maybe whenever it's bedtime tonight, instead of just normal bedtime, maybe we have a little fort built up, like
Mhm.
something to just help us like feel special and engaged with each other, to really help us get back, like tomorrow is a new day,
Yeah. Yeah.
Yeah,
And
yeah,
modeling that's important. So
absolutely.
as we close out, what would you want to leave parents with? Like what's kind of like what you want them to take away?
You got this. Like
Mhm.
this, there's so many resources available with when it comes to connection with people, and understanding, that your child, um, is still the same special, amazing, wonderful, unique, capable human being that you've always known them to be.
Mhm.
And in fact, I think sometimes the empathy and, other pieces of living with chronic medical conditions, offers people, gives insight to human condition like nothing else can,
Yeah.
right? And
Right.
so I think, you know, this is not doom. This is not despair. This is not death sentence. This is something new we have to deal with, and we're going to do it together. So,
I love that.
yeah,
Thank
yeah,
you so much for being here. We
of
really
course.
appreciate it.
Thank you for having me. This is awesome. So excited for y'all. Thank you.